Hello, it's Dr. Gay from First Aid MRI, and this is a 77-year-old male with foot and ankle pain. It's chronic. They saw their doctor and they had x-rays here. It shows pes planus deformity, flat foot, and so they thought maybe they had posterior tibial tendon dysfunction with collapse of the plantar arch, and they did an MRI here to confirm. And on the MRI here, this is an axial T1 weighted sequence. This is the posterior tibial tendon. We're going to watch it come, let's see, start above the ankle joint. Great. This is the supramalleolar portion, juxtamalleolar by the fibula, inframalleolar coming down, and hey, that looks pretty doggone good. So it does not look ruptured. Now where it attaches, it does become a little bit thick. It has increased T1 signal, and that can be a normal finding, or it could be related to mild tendinosis, but it does flare out and get some bright or increased T1 signal within it right at the attachment. Maybe this is just a little bit more than we'd like, but it does not look like it's ruptured. So you could call this mild tendinopathy at best, but just to not get too excited about that. But there was another problem right over here. We see the sinus tarsi looks diffusely abnormal, just socked in with intermediate T1 signal intensity. We put up the sagittal images. We see there's a big hole, like a big bite out of the talus here. Also, the anterior calcaneal process over here has a nice bite out of it as well. So a big inflammatory process centered right within the sinus tarsi. If we put up the T2 weighted images, it has a kind of a classic appearance of bright signal here centrally, and this marrow edema all around the margins, sharp margins where the bone is chronically eroded. And also, if we look at the ligament attachments right here, we see a ligament coming down. We see this broad appearance. This looks right at a ligament attachment. So this is an enthesopathic process, an enthesopathy, because again it does go to the ligament attachment and chronically erodes. And this is really classic for gouty arthritis. And in the sinus tarsi you can get gout, especially in an older male like this. That is by far the most likely thing it could be. But rheumatoid arthritis, ankylosing spondylitis could also do that. You can have infection. They could look like this. But just the scalloping, prominent erosion, and this foggy marrow edema, all are really classic for gouty arthritis of the sinus tarsi. Just one more look at this here. Nice big well-defined margin. See how scalloped and sharply defined it is. And that's it. So thank you very much.